Hi again. Today we're looking at the bones of the trunk, and the first bone is what's commonly called our breastbone, but it's actually called the sternum. The sternum has three parts to it. The top part, it kind of looks like a necktie. So the top part, like what the knot of the necktie would be, is the manubrium. The center section is the body of the sternum, and the inferior end, it's a process, a sticky outy place, and it's the xiphoid process. That's spelled with an X, remember, xiphoid process. So manubrium, body of sternum, and xiphoid process. Also on the trunk we have ribs. So there are 12 ribs on each side of the body, and their names are just first rib, second rib, third rib, or right first rib, right second rib, right third rib, right fourth rib, and so on. Each rib has three main parts to it. The surface that articulates or forms a joint with your trunk is the head, and then right next to the head is the neck, and the rest of the rib is the body of the rib. The body of the rib attaches, in most cases, with some cartilage. That cartilage is called costal cartilage. Costal just means rib, so it's really just cartilage having to do with the ribs. The ribs, this is not their name, but it's kind of a description or a category for them. The first 7 ribs on each side are called true ribs because they have their own piece of cartilage that belongs to them, essentially. And then the 8th, 9th, and 10th are often called false ribs because they share one piece of cartilage. And then the 11th and 12th ribs, you can see them down here, they don't attach to cartilage at all. In fact, their ends, they just float, so they're called floating ribs. Remember, true, false, and floating, it's not really their names, it's a description of their relationship with the costal cartilage. And then lastly, we have the clavicles. They're up here, also known as the collarbones. So there you have the bones of the trunk.